We're now in the middle of February, which is Youth Mental Health Awareness Month. Mental health conditions are increasing worldwide, especially for teenagers with anxiety and depression. And the CDC is out today with new data looking at the mental health of teenagers here in the U.S. And there are a lot of red flags in this report. It found unprecedented levels of sadness, feelings of hopelessness and violence, especially among teenage girls. According to the report, 30% of high school girls said they'd seriously thought of dying by suicide. That is up a lot from a decade ago. 18% said they'd experienced some form of sexual violence. And shockingly, 14% said they had been raped. That is more than 1 in 10 teenage girls. The report also found high levels of mental health issues among gay, lesbian, bisexual, and questioning youth. 52% of these young people reported poor mental health, and 22% of them said they have attempted suicide within the past year. Today, Governor Kathy Hochul touted her proposal for record spending on mental health care with a particular focus on young people.
When we announced $1 billion of investment in dealing with the mental health crisis, which has always been there, under the surface, but what we saw during the pandemic was quite extraordinary, and no one could have foreseen this, even in the first year or two. But now the lingering effects of what the pandemic did to our young people in particular, they're just kind of unanchored during that time, 2 years, and a lot of them, teenage years are tough anyhow, but not to have a support system and to have that connection with an adult or have resources available to them through, even a school nurse paying attention to them. They didn't have that for a long time, and now they're a little bit adrift. And we're losing more young people to teenage suicide and other challenges.
Critics say schools remained closed for too long during the pandemic. The CDC is calling for more programs in schools, including sex ed, to help address mental health issues. As far as advice for parents, the experts say to talk to your kids early and often and try to normalize those chats about mental health.